My name is Dr. Karen Herbst from the University of Arizona, and I'm going to do a physical exam on a woman who has lipedema who has already undergone liposuction. So the first thing I do when examining a woman or a person for lipedema is to examine the head. So I'm going to just tap on the head, and I'm looking for excess tissue up there and not bone. And I can definitely feel bone. And so I know that there's no lipedema tissue here, but lipedema tissue can grow on the top of the head. Then I'm going to examine the back of the head, back here around the lymph nodes, and I'm again looking for firmness of this area, more bony rather than fat tissue, and sure enough, it is very bony, so it's normal. Then I'm going to palpate the neck, and I'm going to do some rolling motion of my fingers. And I'm looking for small nodules in the tissue. And I'm really not finding anything. She has nice and smooth skin. Then I look at the supraclavicular area, and I'm going to ask her to do a little bit of a shrug. Shrug up. Yeah, there we go. And you can actually see she's got a little extra fat in this area, but when she shrugs her shoulders, it actually depresses. And so that's a really good sign that she's actually moving lymph through that area very effectively. Then I'm going to ask her to make a little hole in her hand and breathe in. And that actually pulls the skin down here in the supraclavicular area, and she's still got a little bit of fat in that area. Great, thank you. So then I'm going to examine the chest, and I'm rolling my fingers around the chest, looking for nodular fat tissue, and I'm really not feeling any, which is a great sign. And usually in women with lipedema, they tend to accumulate lipedema fat tissue on the arms, especially posterior, on the hips, buttocks, and thighs, all the way down the legs to the ankles, with the feet less affected. And so feeling that there's very little fat tissue up here is right along with having lipedema. I also am going to check how heavy the breasts are, and they're not heavy at all, so I know that they're not retaining fluid. I'm going to look under the arm, and I'm looking for nodular tissue in this area. And there also can be some fibrotic tissue in this area as it gets close to the breast, which is normal, and I'm not finding any abnormal nodular tissue. And then I'm going to look at the hands. I always bend the fingers back, looking for fat in between the MCP joints here, and I'm not finding any, which is really good. I also look for fat at the base of the thumb. You can pinch up the skin, and you can also roll your fingers around the area of the thumb, looking for nodular tissue, and I'm not finding any. Again, that's consistent with classic lipedema. Now I'm going to look for a cuff sign, so I'm bending the hand back, and there really is no cuff here, which would be a hump of fat tissue that has a nodular feel. I'm going to go ahead and do this rolling palpation of the tissue, looking for nodules. And right over the brachioradialis is a great place to feel it, and I'm feeling very minor nodularity, not much at all, which is consistent with a lower stage of lipedema, stage 1 or early stage 2. And then I'm going to palpate down the arm to the 5th digit along the lymphatic, looking for small nodules, and I'm not finding any. That's a really good sign that she's got normal lymphatics in her arm. I'm going to check for heaviness of the upper arm. I'm not finding any. And I'm also going to examine for nodules all over the posterior or dorsal surface of the arm. Anterior, there can be some fibrotic tissue, which is normal, and she's got a little of that, but no nodules. So the arms appear to be quite normal. Now I'm going to examine the abdomen, and I usually do that from the back. And I can feel nodules right here under the ribs, just a few. But this is a real classic place to find nodules in women who have lipedema. And now I'm going to feel laterally on the abdomen. You can feel some fibrotic tissue here. That's going to be horizontal fibrotic tissue. She has some of that. I'm not feeling nodules. And again, I'm rolling my fingers around. I'm pushing deep, and I'm staying on the surface, just trying to find nodules in all layers. And I sometimes tap around because that causes the nodules to actually bounce within the tissue and you can actually find them. I'm going to examine down here in the suprapubic area. She's got a few nodules here. Again, I'm pushing and tapping and rolling my fingers looking for those nodules. Down here in the groin, they tend to get fibrotic tissue, and she doesn't have any. And it'll be more like a roll when it's fibrotic. Also on the top part of the hips here is a very common place to have fibrotic tissue. And you want to roll your hands up and down the hips looking for that, and I'm not finding any. This tissue right here, this fat tissue here, seems to be non-lipedema tissue, so this tissue would likely be lost with weight loss. Then I'm going to turn her around and I'm going to examine the buttocks. I tend to run my fingers sideways and even up and down on the buttocks looking for nodules, and I'm not really finding any on her, which may be because of the liposuction. I'm going to see if the buttocks are heavy, and they're not. They're very light. And the hips are very light as well, which is great. Now I'm going to turn her around and I'm going to examine her legs. So I start at the top and I'm going to roll my fingers, and you're going to expect some fibrotic tissue here medially, which I do feel, and I feel a little bit of fibrotic tissue out here on the legs. Again, I'm rolling my fingers, I'm pushing deep, I'm tapping, I'm searching for nodules within the tissue. Maybe a few scattered nodules, but not much, which is great, which you wouldn't expect. And now I'm checking for heaviness of the thighs, and I'm not finding it, so there's not a lot of fluid in the thighs. Again, a little bit of fibrotic tissue here, which is normal. Now I'm going to look on both sides of the knees. These are classic areas where you should feel nodular tissue and lipedema, and I'm not finding it. I'm actually going to run my fingers down the leg here. This area right here is a common area for a pocket of fat. It should be nodular for lipedema tissue, and I do feel a few scattered nodules in this area, not many. I'm going to look on the other side, again looking in this area where there's a low area of pressure where fluid can trickle down in here and induce fat growth, and I'm really finding very few nodules. Have you turn around. Now I'm going to look in the popliteal space here. The popliteal area is a little bit nodular, and I'm looking for large and small nodules. I'm finding just some small nodules which are normal. And now I'm going to run my fingers down the back of the legs. These two areas here in lipedema tend to be an area where tissue is actually lost and is nodular, and I do feel some small nodules in both of these areas. Is that tender? No. Good. And I'm going to feel down her leg. She's got a good Achilles here with very little fat around it. She has very little fat around her malleoli. And so she has lipedema that's more consistent with stage 1 than some of the later stages of lipedema because of the absence of fat in this area. The smoothness of the fat tissue, you can't really see any indentations. Turn around, please. You do see some indentations here on her thigh, but she did have liposuction. I feel very few nodules in here, so I think that the liposuction was very effective for removing the lipedema tissue. Lastly, I'll pinch up the skin on her feet, and if I can just pinch skin, then this is called the stemmer sign, and the stemmer sign is negative. There's no presence of fluid in the foot. You can also do the stemmer sign on the toes, again, which on her is negative. Another thing that you can do is look on the sides of the ankle, and what you're looking, or the foot, what you're looking for are pisogenic papules. This is where fat actually herniates through to the skin, and I'm not really seeing any, so that looks completely normal. So I think that this young woman has had a very successful liposuction for lipedema, and that she has really healthy tissue, just some fibrosis and minimal amounts of lipedema left under the popliteal area on the back of the leg. And that concludes our exam. Thank you so much.